6 critical warning signs of colorectal cancer. You may not recognize colorectal cancer has emerged as one of the most prevalent forms of cancer in our modern world. According to recent epidemiological studies, it currently ranks as the 4th or 5th most common cancer globally. Look around your neighborhood, your community, or even your own family circle. You'll likely find someone battling this disease. Even Dr. Wilson's mother was recently diagnosed with colorectal cancer, highlighting how this disease can touch anyone's life, regardless of background or lifestyle. What makes colorectal cancer particularly challenging is its silent progression. When detected early, surgical intervention can remove the cancerous growth, offering nearly a 90% chance of complete recovery. However, most cases are unfortunately discovered in later stages when the cancer has already metastasized to other parts of the body, making treatment significantly more difficult and less effective. In this comprehensive guide, Dr. Wilson shares 6 crucial warning signs that could help you identify colorectal cancer in its early stages. Recognizing these symptoms promptly could literally save your life or the life of someone you love. Early detection remains our most powerful weapon against this disease. High-risk groups. Who should be most vigilant? Before diving into specific symptoms, it's essential to understand who faces elevated risks for colorectal cancer. This knowledge allows for more targeted screening and vigilance among vulnerable populations. The risk of developing colorectal cancer increases significantly after age 50, with statistics revealing that over 50% of diagnosed cases occur in individuals over 60. This age-related risk factor makes regular screening after 50 not just advisable but potentially life-saving. If you have family members in this age bracket, encouraging them to undergo screening could be one of the most caring actions you can take. Genetic factors play an equally important role in risk assessment. If your parents, siblings, or immediate family members have been diagnosed with colorectal cancer, your own risk increases substantially. Dr. Wilson emphasizes that those with family history should begin screening earlier than the general population, typically 10 years before the age at which their relative was diagnosed. Other risk factors include chronic inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, a sedentary lifestyle, diets high in processed meats, smoking, and excessive alcohol consumption. Understanding these risk factors enables more personalized prevention strategies. Warning sign: persistent abdominal pain. First warning sign of colorectal cancer is unexplained abdominal pain. Unlike the sharp, localized pain of appendicitis typically felt in the lower right abdomen, pain associated with colorectal cancer has distinct characteristics that make it particularly concerning. As tumors grow within the colon or rectum, they press against surrounding tissues and nerve endings, creating pressure and discomfort. What distinguishes this pain from ordinary digestive discomfort is its persistence and unchanging nature. It typically manifests as a dull, continuous ache rather than sharp, intermittent spasms. The location of this pain can vary widely depending on where the tumor is situated. The colon consists of several sections: the ascending colon on the right side, the transverse colon running horizontally across the upper abdomen, and the descending colon on the left side leading to the rectum. This anatomical diversity means cancer-related pain can appear almost anywhere in the abdominal region, making self-diagnosis challenging. Dr. Wilson notes that patients often describe this pain as different from normal digestive discomfort. It doesn't fully resolve after bowel movements and doesn't follow the typical pattern of food-related digestive issues. If you're experiencing persistent abdominal pain that lasts for weeks without clear cause, this warrants prompt medical attention. Warning sign 2: changes in stool shape. The second critical warning sign involves noticeable changes in stool shape and appearance. Normal healthy stool typically has a brown color and forms shapes that reflect the natural contours of the intestinal tract. However, when a tumor develops within the colon or rectum, it can physically alter this pathway. As the growing tumor encroaches upon the intestinal passage, it creates a narrower channel through which stool must pass. This constriction forces the stool to adapt to this narrower opening, resulting in a distinctive pencil-thin appearance. Medical professionals often describe this as pencil-shaped stool, thin, elongated, and narrow in diameter. Dr. Wilson emphasizes that this change doesn't happen overnight but develops gradually as the tumor grows. What makes this sign particularly valuable for early detection is that it can appear before other more serious symptoms manifest. The change occurs because the tumor creates a physical obstruction, reshaping the stool as it passes through the narrowed section. Pay particular attention if this change in stool shape persists for more than a few days. While occasional variations in stool appearance are normal and can be related to diet or hydration, consistent pencil-thin stools over several weeks should prompt a medical consultation without delay. Warning sign 3: altered bowel habits. Changes in your regular bowel routine represent another significant warning sign of potential colorectal cancer. Under normal circumstances, most individuals have relatively consistent bowel movements, perhaps once daily or every other day, with stools of consistent texture and appearance. Colorectal cancer can disrupt this regularity in multiple, sometimes contradictory ways. Some patients experience unexplained diarrhea that occurs frequently without any obvious dietary cause or infection. Unlike acute diarrhea from food poisoning that resolves within days, cancer-related diarrhea persists or recurs without explanation. Medically, diarrhea is defined as having more than 3 bowel movements daily with loose, unformed stools. Paradoxically, constipation may also signal colorectal cancer. As Dr. Wilson explains, the colon serves dual functions, eliminating waste while also absorbing certain nutrients, vitamins and minerals back into the body. Tumors can disrupt both processes. Physical obstruction from the tumor can slow the passage of stool, leading to constipation. Studies suggest that persistent constipation in individuals over 50 with no prior history of bowel issues should raise concerns. Most tellingly, many patients experience an alternating pattern of diarrhea and constipation, a particularly suspicious sign that something is significantly disrupting normal bowel function. Warning sign 4. Unexplained weight loss. Unexplained weight loss represents a common denominator across many types of cancer, including colorectal cancer. This symptom occurs through several mechanisms unique to cancer's impact on the body's metabolic systems. Cancer cells, particularly in aggressive tumors, multiply rapidly and require substantial energy to fuel their uncontrolled growth. This elevated metabolic demand essentially steals nutrients from healthy tissues, creating a caloric deficit even when dietary intake remains unchanged. Dr. Wilson notes that patients often report losing weight despite maintaining their normal eating habits. The medical community considers weight loss significant when it exceeds 5% of body weight over a 1-month period without intentional dieting or exercise changes. For example, a 50-pound individual losing 78 pounds unexpectedly within a month would meet this threshold for concern. This weight loss often occurs alongside decreased appetite, as tumors can release chemicals that affect the brain's hunger-regulating centers. Additionally, as colorectal tumors grow, they can physically interfere with the digestive process, reducing nutrient absorption even from the food that is consumed. Dr. Wilson emphasizes that any unexplained weight loss of 34 kilograms, approximately 79 pounds within a month, should trigger medical evaluation, particularly in individuals with other risk factors for colorectal cancer. Warning sign 5. Persistent fatigue. Chronic, unexplained fatigue that doesn't improve with rest can indicate colorectal cancer through several physiological mechanisms. This isn't the normal tiredness after a busy day, it's a profound, persistent exhaustion that significantly impacts daily functioning. When the colon's normal function becomes compromised by a tumor, waste products and toxins that should be eliminated may instead accumulate in the body. This buildup can lead to a general feeling of malaise and lethargy as these substances circulate through the bloodstream. Dr. Wilson describes patients reporting feeling weighed down or constantly foggy, regardless of sleep quality. Additionally, colorectal cancer often causes low-grade internal bleeding that might not be visible in stool. This slow blood loss can lead to iron deficiency anemia, which manifests as persistent fatigue, weakness, dizziness, and sometimes shortness of breath with minimal exertion. The body struggles to transport sufficient oxygen to tissues when red blood cell counts fall, creating an energy deficit at the cellular level. The growing tumor's increased metabolic demands also divert energy resources away from normal body functions, further contributing to fatigue. Dr. Wilson notes that this fatigue often worsens as the disease progresses, with patients describing it as fundamentally different from normal tiredness. It doesn't resolve with rest or improved sleep habits. Warning sign 6. Blood in stool. Perhaps the most alarming yet valuable warning sign of colorectal cancer is the presence of blood in stool. This symptom can manifest in several ways, depending on the tumor's location within the colon or rectum. When tumors grow, they develop their own fragile blood vessel networks that can rupture easily when stool passes over them. If the tumor is located in the rectum or lower colon, the blood typically appears bright red and may be visible on toilet paper or in the toilet bowl. Dr. Wilson explains that this occurs because the blood hasn't traveled far before exiting the body and thus remains oxygenated and bright red. Conversely, if the bleeding originates from tumors in the upper or right colon, the blood must travel a longer distance through the digestive tract. During this journey, it undergoes chemical changes, resulting in stool that appears dark tar-like or black, medically termed metal. This altered blood often produces a distinctive strong odor that patients describe as unusually foul or metallic. Most challenging for detection are cases where bleeding occurs in amounts too small to be visible to the naked eye, a condition called occult hidden blood. This requires special testing for detection, such as the fecal immunochemical tests of FITE that Dr. Wilson recommends. advanced detection methods taking control of your health. Modern medicine offers several effective screening options for colorectal cancer that go beyond just recognizing symptoms. Dr. Wilson strongly advocates for proactive screening, particularly for those in high-risk categories. The gold standard for colorectal cancer screening remains the colonoscopy, which allows physicians to visually examine the entire colon and rectum using a flexible scope with a camera. This procedure not only detects existing cancers but can identify and remove precancerous polyps before they develop into cancer, truly a preventative measure. Most medical guidelines recommend beginning regular colonoscopies at age 45-50 for average-risk individuals, earlier for those with family history. For ortho monitoring, fecal immunochemical tests, Cephites provide a non-invasive option that can detect hidden blood in stool. These tests have become increasingly affordable and user-friendly, costing approximately $2,829 as Dr. Wilson mentions. After using the bathroom, you simply place the test in the toilet bowl. If it turns blue, this indicates the presence of blood, warranting further investigation. While not definitive for cancer diagnosis, these tests serve as valuable early warning systems. Other screening options include flexible sigmoidoscopy, so examining the lower portion of the colon, CT colonography, a virtual colonoscopy, and stool DNA tests that can detect genetic markers associated with colorectal cancer. The 6 warning signs discussed: persistent abdominal pain, changes in stool shape, altered bowel habits, unexplained weight loss, chronic fatigue, and blood in stool provide a framework for recognizing potential colorectal cancer early. However, Dr. Wilson emphasizes that experiencing these symptoms doesn't guarantee cancer presence, but rather indicates the need for prompt medical evaluation. Dr. Wilson shares that his own mother initially displayed few obvious symptoms, yet a routine colonoscopy revealed a tumor that required immediate surgical intervention. This personal example underscores the sometimes silent nature of colorectal cancer and the life-saving potential of regular screening. Remember that the 90% survival rate for early detection drops dramatically when cancer is discovered after metastasis. This stark contrast highlights why vigilance and prompt action are so crucial. For those over 50 or with family history, regular colonoscopies should become part of your healthcare routine, regardless of symptom presence. Developing awareness of your body's normal patterns allows you to recognize meaningful changes quickly. By understanding these warning signs and acting upon them promptly, you empower yourself with the best possible chance for successful treatment outcomes. As Dr. Wilson often tells his patients, in colorectal cancer, time saved equals lives saved. Stay informed, stay vigilant, and prioritize preventative healthcare. Your future self may one day